Hello everybody, it's Sanir, engineer, MBA, and investor. And in today's video, I want to talk about the latest earnings report from CRISPR Therapeutics. This is for Q4 2021, summarizing the year of 2021 officially now that we've got all the numbers in for this company, CRISPR Therapeutics. Now, before we jump into today's video, you guys know the drill. Like this video, smash that like button, subscribe if you're not subscribed, hit the notification bell, and if you have any question, feedback, input, leave it in the comments below. We read and respond to every single comment. So first of all, before I even head in today's video and looking at this press release, I want to wish everybody a happy holiday, especially Americans and most of Canadians. Not all of Canada, unfortunately. Some regions of Canada do not have this holiday today. So hopefully you guys are having a great time studying and making sure that you relax, obviously preparing yourself for the upcoming busy week. At least for me, it will be very, very busy. So CRISPR Therapeutics provides business updates, fourth quarter, full year 2021 financial results. And again, if you follow this channel over the past year, these bullet points should not be something new for you. This is all stuff that we've covered in video from video. We really covered it over the past months. For example, more than 70 patients have been dosed with CTX001. We covered that recently. Also, there's top-line data expected to be reported in the first half of 2022. This is for CTX120 and CTX130. Just as a reminder, these are the three programs, CTX110, and these two programs are for the CAR T cells program. We already have data for CTX110, and we're getting more data, additional data expected for this year. But finally, we'll be getting a lot more data and clarity for those remaining two programs in the CAR T cells that we believe will be successful considering how CTX110 is going. The first patient dose for phase 1 clinical trial for their type 1 diabetes program with ViaCyte. Again, things that we've covered recently. Again, we will be getting data very shortly. In fact, if we look at how Vertex did it with their type 1 diabetes program, it looks like type 1 diabetes program, you can get data right away because of how data and measurements can come in, right? And this is what we saw with ViaCyte, the early programs that they had. So I'm really expecting data to come in within the next weeks or early months. I really expect this before the end of this quarter. I definitely expect data to come in, and we'll see how it goes. I had a whole video on type 1 diabetes with ViaCyte. I highly recommend you guys to watch that video. I won't get into details in this video, but very excited for that program, especially from the TAM potential from type 1 diabetes. 2021 was a productive year for CRISPR Therapeutics on all fronts. We and our partner Vertex completed the enrollment of CTX001 clinical trial on track for planned regulatory submission in late 2022. And this is basically the highlight of this year. 2022 will be all about CTX001 approval, right? It's not about data of CTX001. It's not about, how, can we get more patients enrolled? It's really, will CRISPR Therapeutics and Vertex get the job done? Will they submit for FDA approval? And will the FDA approve CTX001 as the first CRISPR-based therapy in the history of humanity? This is going to be the topic for this year in the CRISPR space, and specifically for this company, all eyes are on this sentence that I just highlighted. So we'll see how it goes. But again, besides that, they have their type 1 diabetes program. They have their CAR T cells programs that it really do matter and really, really are expected to have produced data that is valid, that is efficient, that is safe. Those are programs that everyone are watching for as well. But CTX001, in my opinion, and in the opinion of many investors, basically all eyes are on that program. Right, so a couple of highlights from this company. They got some EMA priority. They got Health Canada to give their priority for type 1 diabetes. Vertex collaboration has improved. In fact, Vertex ended up paying upfront $900 million with a potential $200 million more. And there's a lot of good things coming up for CRISPR Therapeutics. Last year was amazing for them. This year, like I said, a lot more amazing things coming in, but really it's all about CTX001. Their immunology programs, right? So they divided this by their what CRISPR Therapeutics CEO talks about franchises, right? There's sickle cell disease, beta thalassemia, franchise number 1. Franchise number 2 is all about immuno-oncology programs, so CTX110, 120, 130, all about CAR T cells, all about getting that data, complete response percentage, or RR percentage. They want to get all that data in for this year, especially by the end of this year. They want to make sure that they're getting data in. They did announce some collaborations as well with Nicarta and so on. So great things that they've done so far with this franchise. And then the other franchise, which is the regenerative medicine, and this is more about type 1 diabetes. It's all about type 1 diabetes at this point. The CEO did mention about organs off the shelf, so I'm curious to see how that will translate for CRISPR Therapeutics. I mean, we talked about xenotransplantation in our early videos in January. If you guys remember those that breaking news that we were able to edit and basically genome edit a pig's heart and transplant it into a human to save the human life. So curious to see if CRISPR Therapeutics or any company will take on that challenge about xenotransplantation, or at least partner up. Obviously, there is going to be a need to partner up. You can't do it all alone. And then there's the other franchise. In my opinion, CRISPR Therapeutics CEO Dr. Sam mentioned he calls it the in vivo programs. I would argue it's more the other programs, right? The miscellaneous programs, right? It's all the other technologies that CRISPR Therapeutics are looking at. In vivo, base editing, they're looking at different delivery methods. I think this is all the miscellaneous programs. And obviously, they have some partnerships in that franchise as well. Like I mentioned with Capsida that we've covered in late summer last year. So curious to see how this company are going to go. But really, the big news for this quarter is just making sure everything's on track. I mean, they have a couple of programs, a couple of things under their sleeves that I'm curious to see how they're going to develop. Their cystic fibrosis program, the Duchenne muscular dystrophy program. I'm curious to see how that's going to go. But ultimately, it's all about, the fact that they have right now almost $2.4 billion cash in the bank. And I really want to see what will they do with this cash, okay? Is it to develop their third and fourth franchises, which is their regenerative medicine programs and the miscellaneous programs like I mentioned? Or will they go on to do some M&As, right? And this is something that I sort of see I would love to see CRISPR companies with this much cash in the bank to get the job done and acquire some talent, acquire some companies, get their programs, get their licensing, get their talent in, and basically improve your pipeline over time with M&A, as opposed to getting everything created organically in the company. Because again, there is going to be some consolidation in this market, right? This always happens in new industries, in new technologies, in new verticals. It always happens, okay? Always happens. You have new players coming in, people raising cash through private markets, going public, and basically the market's realizing that you can't just have this many players tackling every single disease out there. It just won't happen. It cannot happen. Talent is limited. Funds are limited. Just doesn't make sense. Total addressable market is huge in the whole genomic space, and I do expect to have many winners. But then when you start mentioning Graphite Bio, Verve Therapeutics, when you start mentioning other companies that will eventually IPO, I start getting worried about, will all these companies really survive independently? In my opinion, I think there will be some consolidation. I've discussed with some investors. They have the same type of approach and the mindset about it. But what I do know and what I expect is CRISPR Therapeutics to stand as a standalone company. They have the cash, they have the programs in, they have the furthest program with CRISPR-based therapy. I mean, they've dosed over 150 patients. I mean, there is going to be a winner in this space. And in my opinion, CRISPR Therapeutics must be one of the winners just by the way, they're going forward with it. I would love to see them develop their miscellaneous programs, like I mentioned, in vivo base editing. I would love to see them do some M&As. Curious as to what you guys think. Thank you so much for watching. Like this video if you found value. Subscribe if you've not subscribed. And let me know what you guys are expecting from CRISPR Therapeutics this year, 2022. Is it all about CTX001? Or is there something else under their sleeves? Let me know. Thank you so much for watching and have a beautiful day. Thank you.